Hey everybody, welcome back to the Die Better channel, where we normalize these conversations and education about death and dying so we die better at end of life and make sure that we live a good one until we get there. Today, I'm going to be doing one part of maybe 2 to 3 parts series on treatments and interventions that particularly caregivers can do, like yourself if you're caring for a loved one who is seriously ill and dying at the end of life for them, especially when they develop end of life type of symptoms. So I'll tell you what the end of life symptom is, especially if they're very common. And these non-pharmacological, or in other words, these non-medication, non-medical type of things that you can do to help your loved one get comfortable. This can be used, obviously you always work with your hospice team on anything that you're doing, but these are really complementary to the things that are being medically done, like medication dosage and other type of medical interventions, drains, or any other type of treatments that are done by the medical hospice team. So we're going to start that today, and I'll post these all in order so that you can go back and watch them. And you can really watch them in any order. I will be covering them in probably, like I said, 2, 3, maybe 4 videos. Okay, so we'll get into that today. So let's go ahead and get into the first topic for today. If you've seen some of my other videos before in my series about end-of-life symptoms, and there's definitely more to come on that, there's just so much to cover. But one of the things I have covered is difficulty breathing at end of life, particularly when somebody's in the very, very last stages, usually within the last days, hours, for example. And depending on what they are diagnosed with, depending on their medical conditions, they may be at higher risk or not for these types of problems. One of these problems that is so common that we see, that I've seen in hospice and palliative care, is shortness of breath or trouble, any kind of difficulty with breathing. So whether that's breathing really quickly, like this, or using other muscles that aren't typically used when you're breathing. Usually you might just be using, it might be moving your abdomen and your chest just a little bit to breathe, but you would see someone who's in respiratory distress or any kind of breathing distress, sometimes having kind of what's called air hunger. That's like they just can't get enough. So they're using these, muscles in their neck, right here, sternocleidomastoids, all those type of muscles, and in their chest, and really making a big effort to try to get more air, aka more oxygen, into their system. Now, there are many medical interventions that you can do, and you work with your hospice team, but this video is not covering that. I'm talking about these other interventions that you can do as a loved one when you're by your bedside of your when you're at the bedside of someone that you love that is dying. So this one thing I learned, again, only in hospice. I feel like even though I spent several years working in the hospital and ICU, I learned so much there in terms of like clinical skills. There are so many things that I learned in hospice and palliative care that I just would have not learned working in the hospital. So what I learned is an effective, non-pharmacological, not medical type of intervention that you can do when someone is having trouble breathing. And again, this is complementing the medical stuff that your hospice team is doing. So always, if you're having any issues or your loved one's having any issues with these types of symptoms, you need to contact your physician, contact your hospice team right away, whatever the proper direction has been given to you. But placing a fan in the room and letting the fan rotate in the room is extremely, extremely helpful. It really does tend to help people who are having this type of air hunger and trouble breathing to kind of quell that feeling, that sense of air hunger just a little bit. So the fan is just always really, really nice to have. So even if it's like cold and you've got the heater on and stuff like that, it's important in these situations to try that out, give it a try. Especially if you've already given your loved one a medication and you're waiting for the hospice team to come, you can try putting a fan in the room and putting it on and seeing if that helps at all. Particularly for people who are a little more cognizant, they seem to benefit from having that fan and that air movement around them. Now, two other type of interventions that I've seen work really well. One is called tripoding or tripod position. And I'm not talking about the tripod that you put your camera on. I'm talking about forming a position so that it does help the person breathing. Now, this does require a certain amount of mobility. And again, you need to always consult with your hospice team. Someone who can't really mobilize as well, what you can do if you have a hospital bed in the room or if they are in bed is lift their head up some way to get their head up just a little bit more. And again, you need to learn from your hospice team how to properly maneuver your loved one if you're working with your loved one, or with yourself, how to properly do that safely. Because people, if they're moved too quickly and their head is moved up high too quickly, they can faint and risk injury. So, but a tripoding position, if you have, again, somebody that's more mobile, if you can bring a table to them or a chair where they can just lean forward a little bit, and tripoding is creating a tripod with both arms like this. So you can do it with something that's stable, like a table or a chair, or you can just, have them sit forward. You know how you kind of like when you're working out really heavily and you have to like catch your breath, we naturally do this. And what that does is it takes this diaphragm that's always kind of in this position, it brings it down a little bit because it helps expand the lungs a little bit more. So we naturally are inclined to kind of make this position when we're breathing heavily. That's a little position hack. Now, the other type of thing, and again, I will keep reiterating that you must always run this by your hospice team, because this type of breathing is really specific for people who have COPD, type of obstructive or chronic obstructive type of pulmonary diseases, where they tend to retain what's called CO2, and they're not really good at expelling that CO2. So you really need to, again, always follow the direction of your medical team. And typically with these patients, we would use what's called pursed lip breathing, and it's kind of exactly what it sounds is. You would inhale like normal, and then they would exhale slowly through pursed lips like this. What that does is it does increase the pressure inside your lungs a bit. It helps to release the CO2 in a more controlled way. And with that pressure that you're creating with the slow breath and the pursed lips, it helps kind of try to keep and encourage these other areas in your lung to hopefully remain a little bit more open. Because when you have conditions like COPD, for example, or any type of fibrotic type of stiffness or things like that in the lungs, everything is very stiff. And so the flexibility, the lining and everything of these parts of the lung are just not optimal. So typically with these chronic conditions, they're really working with suboptimal type of issues. So these are just a few of the things, the non-medical medication type of interventions that you can do. I use these a lot when I was practicing as a nurse and as a director in hospice and palliative care for my patients and for my staff to use as well. But again, they always need to be done under the prescription, under the supervision of your physician and your medical care team, like your hospice team, whoever that is going to be. So please, like I said, like my disclaimer, always on all of my pages, none of this is considered medical advice. This is all purely educational and to help you out, and hopefully to help you kind of understand, especially if your medical team has talked to you about these things before, maybe help you understand a little bit more behind them. Let me know if you have questions at all. And if there was something that helped you or your loved one with your shortness of breath outside of medications, let me know, put them in the comments. Again, I will have at least 2 to maybe several more videos, particularly on this subject, on things that you can do outside of the medication realm that are very helpful, particularly at end of life or end of life symptoms. My name is Abigail, here to normalize these conversations and education about death and dying, so we get better at end of life. I'll talk to you soon.